Hello everybody, my name's Matt. I'm one of the advanced practitioners that works here in the IMAP service at the Royal London Hospital. Today we're going to go through how to do a neurointegrity test of the lower limb. The first part of a neurointegrity test is sensation. When checking sensation, you need to make sure that the skin is adequately exposed so you can check all parts of the lower leg. Obviously, Liz here has leggings on. To check sensation, you can use either a cotton wool or a piece of tissue. I'm going to use a piece of tissue today. When you're checking sensation, what you want to do is ask the patient whether there's any difference from left compared to right leg and whether it feels any different to normal. So Liz, can you tell me if there's any difference between your left and right leg and if it's different to normal? Okay. Does that feel the same as that? Does it feel normal? Yeah. Does that feel the same as that? 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 Can you bend your knee for me? And the other one. Does that feel the same as that? And does that feel the same as that? And pop your legs down. When checking sensation, you need to make sure that you cover all the dermatomes in the lower limb. The next part of neurointegrity test is myotome testing. We're going to work our way from L2 down to S2, comparing the strength from left versus right. We're going to hold each strength test for 5 seconds to ensure that we elicit any subtle weakness in the left or the right leg. Okay? You want to make sure that the patient is laying flat and bring the knee up to 90 degrees to test the first level, L2. Can I get you to push up into my hand? So push, 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 and down, and you would do that on the other side as well. L3 is your knee extension. So I like to ask the patient to extend their knee and meet a resistance with my hand here. Again, holding it for 5 seconds and relax. L4 is ankle dorsiflexion. So you want to ask them to pull the toes up towards them and meet your resistance. So push up, push up, push up, push up. Okay. L5 is big toe extension. So can you push up against my finger? Push, 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 push. And then S1 is done in standing ankle dorsiflexion. All right, ladies, now that you're standing, can I get you to hold my hands, stand on one leg and push up onto your tiptoes, up and down 5 times. 3, 4, 5. Very good. The next part of a neurointegrity test is looking at the reflexes. The first reflex I like to do is the knee reflex. So I like to position the patient's leg over my knee, identify the patella tendon and give the tendon 3 taps. You're looking for a reflex jerk in the quadriceps muscle. You're going to compare that to the other side to see whether there's any discrepancy. The next part we're going to do is ankle reflex. What you want to do is ask the patient to rotate their leg out slightly, bring that ankle into dorsiflexion and ask the patient to relax their foot and then tap the Achilles tendon. And you're looking for any discrepancy from side to side. The final part of a neurointegrity test is looking at upper motor neuron signs. More commonly, Babinski and Clonise. Babinski is performed by running a reflex hammer around the lateral aspect of the foot and bringing it round to the medial border at the ball of the foot, like this. A negative sign would be toe flexion, a positive sign would be toe extension. The last upper motor neuron sign is Clonise. What you want to do is support the leg and force the ankle up into dorsiflexion in a quick movement and see whether there is any beats of Clonise or not.